Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what I bring to you from the world of medicine. A recent custom program that can help in controlling blood sugar levels. Study results from 3 clinical trials have shown that a Weight Watchers program, which was tailored for people living with diabetes, helped the participants lose their weight, also lower their blood glucose levels, and also improve their overall well-being. The study results were announced at the American Diabetes Association's 82nd Scientific Sessions. It is estimated that 90% of the people living with diabetes are also living with obesity or overweight, and about 30 to 53% of the new diabetes cases yearly are linked to obesity. Currently, the American Diabetes Association's treatment recommendation recognizes the importance of the weight management protocols in patients with type 2 diabetes who also have either overweight or obesity to improve their glycemic control. The 6-month single-arm clinical trial was conducted across 3 sites, and the researchers examined the effectiveness of the virtual Weight Watchers program on their glycemic control as well as weight loss among 136 participants who were previously living with type 2 diabetes condition. The results demonstrated that the Weight Watchers diabetes tailored program had clinically meaningful and statistically significant effects, including that caused a reduction in the HbA1c levels, an average decrease in the participants' HbA1c levels at 3 and 6 months that lasted standards set by the FDA for approval of even pharmacotherapy, that is treatment taken with either of the medication. The average body weight loss was 5.7% and a decrease in the waist circumference by more than 2 inches also happened. A modest weight loss of at least 5% of a person's body weight can help lead to health benefits, including improvements in blood pressure, blood cholesterol, and even blood sugar. There was even noted a decrease in the diabetes distress by 9.8%. Participants experienced a reduction in emotional burden, regimen-related stress, and even the overall diabetes distress. Built on Weight Watchers' science-backed approach, the tailored program did help people with diabetes build and maintain healthy habits based on their needs and lifestyle. How a mere 20-minute break is very much essential for all healthcare workers. A review was done at the Euro-Anesthesia Congress on the potentially lethal effects of fatigue on doctors and nurses themselves and its impact on the quality of their clinical work and judgment, and therefore compromising on the patient's safety. It was found that due to these risks, the healthcare should have formal risk management systems like those required by law in every other safety critical industry. A sleep debt begins building after 2 or more nights of restricted sleep, and it takes at least 2 nights of good sleep to recover from this. Cognitive function is also impaired after 16 to 18 hours being awake, leading to deterioration in the medical worker's ability to interact effectively with patients and colleagues. When the fatigue sets in, the medical and nursing team are less empathetic with patients and colleagues, vigilance becomes more variable, and logical reasoning is definitely affected, making it hard to calculate, for example, the correct doses of drugs a particular patient needs. Also, doctors find it hard to think flexibly or to retain new information, which makes it difficult to manage quickly changing emergency situations. Their mood gets worse, so the teamwork definitely suffers. Hence, everything that makes us and our patients safe is definitely affected. The researchers therefore concluded that they need to change the way night shifts are managed to mitigate the effects of fatigue. Those working shifts must ensure that everyone gets a power nap and that there is support for each other to remain safe and vigilant when working through the night. The staffing schedules should also allow sufficient amount of time between the shifts for proper rest, and no one should do more than 3 night shifts in a row. Hospice care and their quality in people with dementia. A new study shows that hospice patients with dementia are more likely to receive excellent care and have their anxiety and sadness managed than those who are not on hospice treatment. However, the eligibility criteria means that some patients with dementia, they face hurdles gaining access to that hospice care or even may risk the disenrollment into various programs. In the study, the researchers tracked a sample of 2,059 seniors over 70 years of age who had died between 2011 and 2017. Some 40% of these seniors had dementia, of whom 59% used hospice, which included regular visits by their nursing staff, social workers, and chaplains provided at the patient's home, assisted living facility, nursing home, or dedicated area within the hospital. Of the 60% of the seniors without dementia, 43% used hospice. The researchers compared the quality of care in the last month of life between patients with dementia on hospice and patients with dementia not on hospice therapy. Some 52% of the hospice enrollees' caregivers said that the standard of care was excellent versus 41% in the non-hospice enrollees. Additionally, 67% of the hospice enrollees' proxies said their sadness and anxiety was well managed compared to 46% in the other group. Results also showed that the hospice enrollees were less likely to be switched to a different care setting than the non-hospice enrollees in the days before their deaths. The findings suggested that hospice significantly benefits the enrollees with dementia and that it underscores the need to ensure access to high-quality end-of-life care for this growing population. A different perspective of obesity. Researchers are recommending a stronger move towards less stigmatizing standardized terminology in scientific journals and with patients, which reflects our understanding of obesity as a term or particularly a disease. This is in accordance to a new study that was published recently in the Obesity Journal. The mechanisms that are contributing to the development of obesity are increasingly well characterized. However, deeply ingrained perceptions within the medical community and the public have seen that the persistence of negative attitudes towards obesity has increased. Now, this study aimed to assess how frequently negative terminology was used to report a bariatric surgery. A secondary goal was to evaluate the patient's perspective of potentially stigmatizing language and its implications for forming constructive relationships with healthcare providers and engagement with weight loss interventions. The results revealed that around 3,020 papers were screened. 2.4% were included the term fail and 16.8% contained morbid used in conjunction with obesity. These were the negative terms, that is fail and morbid, that was used constantly with obesity. The patients felt that negative language, particularly the word failure, implied a personal responsibility for the lack of weight loss. Our words truly do matter. The old expression which says, "Sticks and stones may break my bones, but words will never hurt me," doesn't apply for those living with obesity. And as it has been demonstrated, poor or outdated language hurts the provider or a patient and ultimately keeps people with obesity from seeking or rather receiving care. So the message given out here is, it's time we prioritize better language around obese people. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.